All right, thank you for joining me today. And today I'm going to do a little bit of a midterm presentation for my last semester at Oregon State University. This is going to be in regards to radiation health physics as my master's degree. I am doing a project on target nuclide therapy using Lutetium-177 PSMA, right? So I'm going to go into it a little bit more, explaining what it really means, what the PSMA is, what Lutetium-177 is, and how is it so great in this field of research. This is a very, very new science, very, very new research. Came out in around 2022, so it's relatively very, very new. All right. Like my name is David Capobianco. I am doing a master at Oregon State University, like I said, in radiation health physics. So this is a project for my presentation for my class, but I'm doing it in a YouTube format because even though it helps me to do this type of presentation in like for my grades, it's actually could be helpful to you guys as well if you are interested in this topic. I don't want to make this video too long, so I'm not going to go into too much, but like I said, this is a project for my professor, but it's also I'm making it for the YouTube audience as well, so that maybe I could inspire you to learn more about this. If you're having some question about this type of therapy, I have a little bit of basic knowledge on it here as well. But yeah, so if it help all, I have my rank badge on here. I know I'm not supposed to wear it in civilian uniform, but this is just kind of a stab at my past my past unit. It's a little bit petty, but they told me I wouldn't be able to make officer, and here I am. A little bit of news for you guys, right? Yeah, just you can't hold me back, right? No matter how racist you guys are. A little inside joke for the YouTube community. All right, let's kind of move on. We're not going to talk any more about that thing that's not related to this anymore. All right, so now the scope and focus of this presentation will be on Lutetium-177 PSMA therapy, and I will go deeper into it. And it emphasizes on physical and radiological property of Lutetium-177, right? PSMA biological targeting, and PSGA-68 PSMA PET imaging, which is what we are going to use before we start using the treatment, which is Lutetium-177 or Lu-177. I'm just going for more fluid because it's easier to say Lu-177 than Lutetium-177. I'm just going to refer to Lutetium as Lu from now on, right? Clinical trial evidence and FDA approval and dosimetry and Oregon at risk, right? So we'll go in that order. Just a little intro. What is it? It is a type of radiation treatment to help treat prostate cancer by targeting those cancer cell in the prostate cancer where they would have very specific hormones that are being released, and we're using smart type of radiation that would just only target that type of cells. That's pretty much what it is. And it used the hormones that are being released, the PSMA hormones that would usually be released a little bit more from prostate cancer cells that would be releasing this hormone, so that how we would target it. So this is kind of where this type of treatment really come in and why it's so revolutionary. It's very smart. It's like smart weapons pretty much for cancer cell, right? So this, like I said, this is relatively new information. This is relatively new science. So not everything is too maybe as modern as you may think. So if you're watching this 5 years from now, a lot of this information may be out of date. Just keep that in mind. But at least it's giving you guys a kind of brief overview on it. This is and disclaimer, since this is going to be on YouTube, I am not a medical doctor. I am going to have a degree in radiation health physics, so I have a specialty in health physics. I am not a doctor. This is not medical advice. For medical advice, I would recommend you talk to your doctors, right? So this is for education and entertainment purpose only, right? So Lutetium-177 or Lu-177 radioactive radionuclide overview. So Lutetium-177 or Lu-177 is a therapeutic beta emitter, so it releases beta rays from the nuclear radii nuclides when it decays, right? So that's what it's mainly released is beta rays, right? What are beta emissions for people who may not know, who may not have great understanding on nuclear or radiation physics? It is usually a very high energy electrons, so it's beta rays are just mainly electrons. Just easier to just think of it that way. Classify as medium energy beta emitters, right? Also emit low energy gamma photons for imaging. So Lu-177, when I was reading it, there was different ways of using it. One of the ways is using it for both imaging and therapeutic as well. So you could use it to release gamma photons like it's doing right now, and kind of using it to see imaging of your cancer cells and whatever you're trying to do as well. So there's two ways of using it. I know you could also use gallium for imaging as well. So there's I guess more than one way of eating the cake, I guess. Well suited for targeted radionuclide therapy. And this is what this presentation about is. Targeted radionuclide therapy, radiation therapy. Since our science is getting more and more, this is what usually medical and health physicists would be kind of studying, is using nuclear science to help people and cure certain diseases that maybe traditional hormonal therapy would not be able to do, right? So this is kind of my field. If you're interested, like I said, my school right now is Oregon State University, and maybe you could pursue it as well. So let's go to the next slide. Before I forgot, as you may have seen from the first slide, all the pictures are either being generated by me myself, like this. I draw it myself. This is just kind of the decay tree, or it is generated by AI. So no references are required. I did have one image that was taken from the web, but I already have the link of the image on there as well. So everything there is not copyright at all, or plagiarized as all. The one that is being taken out, it has a source underneath the image. All right, so that's just one image in the later slide. Just a quick disclaimer: physical property of Lu-177, right? So it has a half-life of 1.6 days, so it's not very long. It doesn't have the type of let's say concern that you would have if it would stay in the body for a very long amount of time and have radio emissions for the rest of your life type thing. It has 6.7 days. It's relatively quick. Your body will probably get rid of it before it decays, but if it does kind of stay in like a sink, and that's a kind of a physics term. A sink is like if something goes in and doesn't come out. If it does kind of stay in your body, it does decay quite quickly. It allows sufficient time for radiopharmaceutical, so it doesn't decay too fast that you wouldn't be able to get the benefits out of it, right? So some radiation nuclei will just decay too fast, and it just like have this big burst of energy, and it's just all gone, kind of thing. So you want the type of like long enough of radio pharmaceutical to take effect, right? So like enough radiation to stay there long enough, right? So like I said, radio pharmaceutical distribution, so it takes time for your body to circulate it through the system to get to the prostate, and we'll talk about how it actually gets into that area later. Like how would the doctor or medical physicist or your radio technician, nurse, or whatever, how would they get it into that target area? And we'll talk about that later, right? So tumor intake, uptake, right? So it allow for the tumor to actually take into it, right, to really absorb that radiation, kill itself, right, and clinical logistics as well. Like those are the main things that we're looking for with this, and why it's so important that Lu-177 is so nice when it comes to that, right? So it's a balance between effectiveness and patient safety, right? So like versus like chemotherapy, where it's require a lot of procedure, where you need to go to a hospital, you have to lay inside this huge machine. There's a lot of scary stuff. Or hormonal therapy, where you would put hormones into your cells or into your body in order to treat prostate cancer. This give an alternative to that, where it is pretty effective, very efficient, right? And it's also really good for safety for the patient, and we'll talk more about that because it's very good at targeting just the cancer cell and leaving healthy cells alone. And we'll talk about why that is the case in later slides. All right. So radiological properties of Lu-177, right? So it's, like I said, it emits beta particles that deposit energy into the tissues. And we'll talk about those calculations. I don't know if I'm going to talk about that maybe in the final projects, right? So, but the mean tissue penetration is 0.7 millimeters, right? And max penetration is around 2 millimeters. So that's how deep the radiation of beta particles usually go in Lutetium-177, right? Short range limits radiations exposure to nearby normal tissue. So relatively, you can kind of tell it's pretty small. So you're not going to, even though you have it in your cancer cell or in your prostate, it won't penetrate enough to kill a lot of good cells or turn them cancerous, right? Because radiation can do that as well. So now, prostate-specific membrane antigen, right? So PSMA, which is what we talked about at the beginning of the lecture. PSMA, I'm going to refer to it as that. It's a type of protein. It's a type of hormones, right? So, like I said, it's prostate-specific membrane antigens, right? And I'm just going to refer from this point on as PSMA, right? And PSMA is a cell surface transmembrane protein, right? So it's a protein that is released by cells, and it's particularly overexpressed in cancer cells. So if cells are cancerous, they would express PSMA in higher than usual quantity. And this is why it's very important in this type of treatment, why PSMA really play a key role of it, and how it helps with targeting that really specific cancer cells, right? Because of its we're sending it to just attach to that cells that are releasing a lot of hormones, these type of protein, right? PSMA protein, right? Expression increase with tumor aggressiveness. So if tumor spread a little bit, if it's going into higher stage cancer, it actually release more of these PSMA hormones or proteins, right? It's metastatic disease, and with this type of cancer cell, the treatment is more resistant, right? So it's resistant to more traditional hormonal treatment, right? So in this case, this is hoping to go around this type of problem that traditional treatment might have, right? So it's not something that would replace treatment that would be traditional outright, but it is a supplemental thing that we can use if the other one fail. We could use this as well, or it's just good to have more tool in the toolbox, right, to tackle the same problems. So little image here that's generated by AI. It's just a very good illustration of really what lutetium really goes. You can kind of see here. I don't know if you can see my mouse. Like it released cancer cell release PSMA hormones, which allows these lutetium radionuclide to attach to it a little bit easier, and we manipulate it so it would attach to the PSMA hormones, right? And that's kind of the key here, right? So PSMA targeting mechanisms. So that's what we're going to talk about right now. a really good illustration again from the AI that I was able to prompt, and it was really fun that we are in this new age of AI, which can give you very, very visualistic representation of what it really is, and I've just explained to them what it really is, and they're really good at doing it. So PSMA gallium binds to receptor on tumor cells membrane, right? So ligand receptor complex is internalized. Radio label lithium Lu-177 is brought inside the cancer cell, resulting in a highly localized radiation delivery, right? So, like I said, the proteins in the cancer cell release a lot of these type of protein that would be overly expressed. So you would have something that we would put onto the lithium-177 that would bind to this type of receptors and would be able to deliver it right inside the cancer cell and kill it. Very targeted type of a weapon that would attack just cancer cells more often than not, right? Because it overly expresses this type of protein, right? So that's kind of how it the idea of it and how it really is expressing in this type of environment, right? So, why PSMA is an ideal therapeutic target, right? Because it is because high tumor to background expression ratio. So, like tumor would express these type of protein way more than the healthy cells would, right? So it would be easier for you to kind of target, and especially when we have like PSMA that would kind of like target to that protein and would bind to it, specially made to do that, to bind to those specific protein receptors. This makes it so it would be easier to kind of target and go and attach to it, right? So maintain expression in advanced prostate cancer. So this is uniquely to prostate cancer for now. So it doesn't. So right now the research is all within prostate cancer. So which is nice because prostate cancer does kill a lot of men per year. So at least we can cure or help treat certain type of cancer. It kind of may lead to other type of cancers being treated in the same way. But this is specifically to prostate right now, right? I'm not sure if I explain it. This is kind of more or less unique to prostate because of the protein is being produced, right? With protein, like cancer cell when for prostate would express this, right? It's maintained expression in advanced prostate cancer, right? And it enables selective targeting while sparing most normal tissue. So this little image right here, where you have this representation that's made by AI again, that is of representing a cancer cell, and like you can see the Lu-177, lithium-177 with beta emitters here attaching to the PSMA receptors, right, in the protein in the cancer cell. And look at this, like healthy cells right here. So it doesn't really like there's no lithium being expressed here because it doesn't express enough PSMA, right, proteins. So that's where this science really come into, and that's what really the nitty gritty of it. It's pretty simplified, right? It's relatively simple. It's just getting it to work is kind of the key, and they're very promising at this point, right? And it's being very effective new treatment. So Gallium-68 PSMA PET imaging. So like I said before, Lutetium Lu-177 also can do imaging as well because it does release a little bit of gamma ray, but it doesn't do as much. So a lot of time you'll use Gallium-68 PSMA PET imaging instead, where you would put Gallium-68 in to kind of see whether these proteins are being expressed before you would put in the Lutetium-177 type of treatment. So it depends on the treatment, it depends on the research. There's many papers on this. They're looking at different ways of doing it, but right now Gallium-68 tend to be more efficient in just imaging it. This is kind of a type of imaging that you would kind of see. I have AI generate this image as well, so I didn't steal it. But it is quite amazing what AI can do now. So like you can kind of see what it kind of would show on the PET's imaging, right? And the way PET imaging work is just by the radionuclide, like the gallium-68, that would send photons out, and we would kind of detect it. But we're not doing a class on that right now. This is about lutetium, and just kind of know this is what we use to kind of see the cancer cells first and see whether or not it actually expresses enough hormones or whatnot, and if Lu-177 treatment would be effective, right? It provide high resolution whole body tumor visualization as well, right? Because prostate cancer doesn't always stay in the prostate. It could be malignant. It could detach, go into the bloodstream, and go attach somewhere else in the body. And because it is still considered prostate cancer, even though it's in other parts of your body, like could be in the brain, could be in the lungs, could be anywhere really, it is relatively easy to treat it with this type of method. Now, it could be going to other places, and it would still be cancer cells from the prostate. We would express the same PSMA protein. Just kind of know that, right? So the role of Gallium-68 or Ga-68 PSMA PET as a companion diagnostic, right? So hope you like the little AI generated image. Look very real, right? All the fingers are right, but this is by AI, I guarantee you. Confirmed presence of PSMA expression tumors, right? So that's the big thing, to make sure that the protein is being expressed by these tumors, right? Identified patient likely to benefit from Lu-177 therapy. So if they don't express enough of these type of proteins that would allow Lu-177 to attach to it, you would probably look at other type of treatments in that case, such as treatments into hormonal therapies or other type of radiation therapies like chemo or whatnot, right? Prevent treatment of patient without adequate PSMA uptake, right? So if you have, like, let's say a patient have a cancer, prostate cancer, but it's not very expressing it much because it's still early stages, this would not work. So it doesn't make sense to give them radiation dosage that is not required, right? So that goes into our concept of ALARI, as low as possible, right? Radiation therapy, right? Or radiation exposure at all, right? Central example of theranostic concept, right? So it's just kind of like doing less harm, like as least of as expressing as possible, or as less exposure to radiation as possible when it's not necessary, right? Critical trial evaluation of Lu-177 PSMA, right? And that's kind of the whole type of a name for it. It wouldn't just be Lutetium-177 or Lu-177 treatment. It would be Lu-177 PSMA treatment. That's the whole name of it, right? So the PSMA is there because it is important to this type of treatment, right? So we're gonna look at, and this is not from AI, so you can see the little in the bottom of the picture where the source is, right? So so this is from the FDA, from this Digital Science Press, but like with any type of drugs, any type of treatment, especially with radiation, you have large randomized clinical trial evaluate safety, efficiency, survival outcome, right? Because you're putting radiation into the body, right? So you need to make sure it's safe. Focus on patient with metastatic castration-resistant prostate cancer. So it's mainly for people who are at the point at the last, or at this stage, right, where this experimental treatment may still be used, where like we already exhaust all options at this point, right? We can't use hormone therapy, doesn't work, chemo doesn't work, right? Now at this point the patient is probably going to die at this point, so like if we don't do anything, so it's better safe, like doing this won't actually kill them more than the cancer would already kill them, right? So at this point this is where it's being focused on, but as the studies of this and the approval comes out, it will be used more and more and more, right? With more patients, right? So So this is one of many, and right at this point, it is at the stage where it's for people who doesn't respond to any other type of treatment, right? Key clinical trial outcome, right? So it improves radiological progression and free survival, right? So that it has been shown to help survival rates in patient, reduce in prostate-specific antigen PSA levels, right? Improve quality of life compared to standard care, right? Standard care, other type of treatment, very invasive, may lose your hair, may lose other things. It really does impact your quality of life in other ways as well, because other type of treatment may kill healthy cells as well, so you're going to feel weak all the time. This tend to be very more targeted, so it actually very favorable safety profile as right now. Acceptable and manageable toxicity profile, right? Because it's very unique, where it would kind of target those cancer cells, and if it doesn't, it just tend to just leave your body by itself. It usually you just pee it out, or your liver just kind of filter it out, right? It doesn't go into the thyroids like iodine. Some radioactive iodine would go into. Relatively safe right now based on current evidence, right? FDA approval of Lutetium-177 PSMA therapy. So FDA approved was granted in March 2022, right? Approval, so it's very new, right? Approval for PSMA positive MCRPC patients, right? So that's big acronym. We're not going to go into that, but it's for a very specific patient that doesn't respond to other type of treatment, and it also people that have PSMA positive proteins that their cancer is being produced. The cancer cells being produced. Not all of them will always produce it, especially when they're on the earlier stage of prostate cancer, right? We require confirmation of PSMA expression by PET imaging. So this is very important. You cannot give. It's illegal because the FDA have put that kind of in, where you cannot give that type of treatment without a proper level of PSMA being expressed by the imaging, right? That we can get. Represent a major milestone in nuclear medicine therapy, right? So a lot of people don't know the benefits of nuclear, and one of it is medicine, right? So a lot of people think of medicine as some chemical drugs that they made in like the back of a lab or something, but now this is putting in some radioactive isotope into your body and curing cancer with it, right? So, organ at risk, okay. So, there are some benefits to it, a lot of benefits actually, but there are some side effects, and there are some organs that would be at risk because we're putting radiation into the bloodstream, and that's actually how you would kind of inject this type of radiation, and usually it goes through the blood, right? You would inject it into the blood, and that's how the treatment would go into your body. So because it's in the blood, so there's several glands and several organs that we need to look at, right? So you have salivary gland, right? You have which is in your mouth. You have kidneys, right? Because when you talk about blood, kidney filter out the blood, right? Kidney and liver, but kidneys tend to be a little bit more prone to this type of radiation. So because it's going into the blood, into the kidneys, to be filtered, if it's not being attached to the PSMA protein receptors in these cancer cells, it's just eventually you're gonna piss it off. So it does your kidneys does have to filter it out, and when it's being filtered out in the kidneys and being it's there causing damage, right? Because radiation being expressed is damaging. Is damaging the cells that it's around, right? Even though the penetration is not that deep, if it's inside, it is going to affect that cell that it's touching, right, or near. Kidney, bone marrow is always a concern, right? Bone marrow is where a lot of stem cells are being produced. A lot of white blood cells are being produced. So if you're with anything, if you're being exposed with a lot of radiation, your bone marrow is the first thing that we really need to pay attention to. Sometime with any type of radiation, a certain amount, so around 2 to 5 grays, you would start looking at bone marrow transplant, all right, or maybe even higher, right? Um, so other that I didn't put in here would probably be liver, because it also filters the blood, right? You have the intestines, because it's where the waste goes. So when all these radiation nuclei goes out the body, it goes through the places where it needs to be released. So all the track in between is something that we're going to need to be concerned of. I guess I didn't really explain to you how this type of radiation impact the cancer cell, and that was a few slides ago, but I'm just going to tell you now. It does a double strand break on the DNA to kill the cells, right? So you're trying to get cellular apoptosis, right? Where you're trying to have the cell commit suicide by breaking the DNA strand inside itself to make it kill itself, right? So it can't reproduce anymore and it just dies, or express any type of information, right? So apoptosis. So I'm still working on that kind of term. So Lu-177 PSMA therapy integrates physics. So like I said, I'm a health physicist. So or I'm in my last semester doing my master in health physics. So physics is a big thing, a lot of math involved. Radiation is always physics, biology, of course, because we're talking about the body, imaging, and dosimetry, right? Of course, you talk about chemistry as well. You talk about because of all the things that you need to understand, because chemistry or biology is a derivative of chemistry, right? But it's mainly with physics and biology for this type. So a lot of medical physicists will be working with medical doctors to help treat patients with this type of therapy for sure. So in conclusion, Lu-177 PSMA therapy represents a significant advancement in targeting radionuclide therapy by combining well-suited radiophysical property with highly specific biological targeting, right? That's what we talked about, where it's looking for that specific, like a targeted smart missile, going for that's cancer cell that's expressing too much PSMA protein, right? The beta emission on Lutetium-177 allowing for effective tumor cell irradiation, while limiting those to surrounding tissue, because it has low penetration, and it will just go to just that cancer cell and leave mainly the surrounding healthy tissue alone, right? PSMA overexpression enables selective delivery of prostate cancer. Gallium-68 PSMA PET imaging server and critical role of companion diagnostic, ensuring appropriate patient selection and supporting personalized treatment. Clinical trial outcome demonstrate improved disease control and acceptable toxicity led to FDA approval, etablishing that Lu-177 PSMA therapy is the standard option for PSMA positive metastatic prostate cancer, cancer that is resistant to other treatments and express a lot of PSMA. Together, these elements exemplify the therapeutic approach and highlight the integration of physical biology, imaging, and dosimetry in modern nuclear medicine, right? So hopefully, and this is my reference. This comes to the end of my recording or my presentation. If you have any question below, please put it in the comment below. My name is David. Again, I'm doing a master's in radiation health physics at Oregon State University. If this is a type of education or this type of field that you think is very much in your interest, I would pursue it at Oregon State. There are many options. There are other schools that you can go to as well, but hopefully it does inspire some people to come into this field, right? Because it's a mixture of both physics and medicine, right? Which is something that I am interested in, and that's why I chose this major, right? Another quick disclaimer, which I already stated, I am not a doctor. I am not your doctor. It is important for you to discuss with your doctor before making any type of conclusions or anything, right? I am just a guy on YouTube that you saw that's doing his research project at Oregon State University for his master, right? I am still just a student. I have not finished my degree yet, so I am not a professional to be giving you that advice. This is for education and benefit and educate and entertainment purpose only, right? For my project, and I just happened to put it on here for aspiring people who wants to learn more about this field, right? If you have any question, like I said, put it in the comment below. Hopefully you like my presentation, and I done a lot of these presentations before, so please subscribe and like, comment this video so other people can see it. I don't get paid out of this video at all. I will be making a further video for my final presentation on Lu-177, and that will be my final radiation videos that I will be posting on YouTube for foreseeable future, unless there is requests for me to discuss certain things. All right, guys, and thank you for watching. And Professor, hopefully you enjoyed this video as well. Like I said, I am making this form the project, but I'm putting it on YouTube, so I am making it in a way that people on YouTube who don't have this degree would be able to understand and enjoy as well. All right, bye, guys.